As for current issues involving PAs, there is one right now that is highly debated among physicians, and that is the relationship that PAs and physicians have together and how physicians should use PAs correctly. Now, the issue comes in with PAs not being used in the appropriate way. PAs can do certain procedures and tasks without any supervision, but some require that a physician be present at all times observing what exactly is going on with the PA. Now, problems that could happen is you could run into medical malpractice by having a PA perform a procedure that they are not licensed nor skilled to do, could land you up in medical malpractice court. The other thing is physicians are having PAs who are well trained and by every means can do procedures alone without supervision, but the problem is physicians are charging for procedures at a physician rate that are not being performed by physicians. So they'll charge for, say you have a surgery done and the surgery is not completed by a physician and a PA is the one who does it, but the physician still bills as though they were the one that did the procedure. That is medical insurance fraud and can land you in serious trouble with the federal government. Both could land you up in court. The best way to avoid these issues would be to make sure that you always have a direct supervision by a physician if that is what is required. As far as staying out of medical malpractice by not having PAs who are trained properly, it's very important for physicians to take time out to properly train their PAs. Going to PA school, you get a very general knowledge of healthcare. And the great thing about being a PA is you can go into different facets of healthcare. But without proper training, PAs shouldn't be expected to come into a different field and know exactly how to perform everything and do every procedure. Physicians need to take their time to get in there and train the PA. That all goes with good communication. Patients should see PAs as an extender of the physician. PAs are there to work with physicians. They are meant to be a healthcare team, to come together and do what's best for the patient. And in a lot of ways, it's better for a lot of patients because they have two highly trained and skilled physicians in a way looking at their healthcare and making decisions. And as far as that is concerned, that is the best way for a physician to stay away from getting into these issues of having medical malpractice or medical insurance fraud by having an open and good communication with your PAs. This is a list of my references where I got all my information. There I only used one outsource, which was North Florida, and then the actual website itself. The other one that is on there is the GainesvilleSun.com, and they were my evaluator of the hospital. They did a great article on what North Florida is doing right now, and you can look that article up there. Thank you very much. I hope you enjoyed my presentation and found it very informative. I've enjoyed looking into what it takes to be a PA more and kind of getting a good understanding of what current issues are that involve people actually practicing in the field. Thank you very much.